The push is on to refocus and retrain our police officers to embrace self-care. Our 11 News investigation team alerted you first to the challenges some officers at the Colorado Springs Police Department are encountering when they try to get long-term workers' compensation benefits after they file for mental health-related claims. But now we're shining a light on the top-to-bottom review and changes within the department to provide more mental health services on the inside. Here's morning anchor Matt Kroschel.
Just the day in and day out stressors.
Police officers, they see a lot, and in the past seeking out help to process all that trauma, well, things were different.
I think that stigma's changing.
Michael Snuggs should know he leads up the wellness unit inside CSPD.
When I came on 20 years ago, it was like, you do your job, you're going to see some traumatic stuff, and it's on you kind of figure out how you're going to go work through it.
But that's not the case anymore, or at least that's not what Snuggs says he's seeing within the department now.
It's actually growing. I think it's trending up.
CSPD's peer support program, for example, where officers help fellow officers, and it's growing.
58 officers are involved in peer support. They've all been trained.
And there's the specialized counseling for officers and their families.
3 separate psychological services providers that are contracted through the department.
And while Snuggs writes more grants, the programs are expanding. Other law enforcement agencies now across the state taking notice.
We've kind of been a little bit of a role model in terms of what we're doing, and people reach out to me all the time. Aurora is a great example of finding out what services we offer.
But there's still work to do.
That sense of, is it okay? Is it okay to ask for help? How do you change that perception?
My hardest job is getting the older guys that have been on 20, 25, 27 years to accept that, hey, you've seen a lot of stuff in your time, and not necessarily at the beginning did you need this, but with the traumatic events and experiences that you've accumulated over the years, your bucket's full.
I'm Matt Kroschel.
Officers are learning how important that is.
11 News.
Officers can also seek outside professional mental health care covered by their employee benefits program.